Hi, good evening. My name is Nancy, and I'm going to talk about benign skin diseases. People may develop a variety of benign skin lesions throughout their lives. Because many of these lesions are visible, patients frequently seek medical confirmation that the new skin growths are benign. Within these lesions, we have seborrheic keratosis. Seborrheic keratosis it is the most frequent benign epidermal tumor that usually appears after 40-50 years of age and manifests as a raised, well-defined, round or oval lesion with a dull and hyperpigmented lesion whose color varies from light brown to black. Its size varies from 0.5 to 2 centimeters and it is usually located on the face and upper part of the trunk. These are asymptomatic. Chronic irritation due to friction trauma may occasionally cause pruritus, pain, or bleeding. We have two variants, dermatosis papulosa nigra and stuccocerosis. Risk factors, genetic predisposition to develop a high number of OSK, UV radiation exposure, human papillomavirus. Physical examination. Try gently picking or scratching the lesion. May crumble, flake, or lift off reveals the waxy texture. Common places: trunk, face, and upper extremities. Compared to the rest of the growth, does it resemble the rest? Always take the skin lesion that looks different than the rest. If you have a doubt, you can order a biopsy or refer the patient. Diagnostics is made by dermoscopy. The dermoscopy shows us milia-like cysts, white arrows, and comedo-like openings, network-like structures, and fingerprint-like structures. Hairpin basals, solid square, milia-like cysts, white arrows, and comedo-like openings. Giri and sulci. How about the treatment? It is asymptomatic. If for cosmetic reasons wish to be removed, the alternatives are cryotherapy, curettage, shape excision, and electrodesiccation. Alternative treatments are castor oil, raw and organic apple cider vinegar, and aloe vera gel. Follow up only if the skin lesion changes color, texture, or grows rapidly. Acrochordons. These are a small stalk-like growth of normal skin. Risk factors are friction, genetics, and obesity. Treatment consists of cut, liquid nitrogen, or electrodesiccation. What should the patient know? It is a benign lesion, out-of-pocket expense. Alternative treatments are tea tree oil, banana peel, and apple cider vinegar. No follow-up is required. Cherry angioma. They are round, oval, bright red, down-shaped papules. This can appear at the age of 30 or 40. The diagnosis is made by dermatoscopy, which shows red lacunae in an hemangioma, red, blue, and black lacunae in an angiokeratoma. Treatment. Small lesions can be electrocauterized, shape excision, and electrocauterization for larger lesions. Laser therapy can also be used to remove superficial lesions. Cryotherapy is another option. What should the patient know? Only necessary for patients who are bothered by the lesions. New lesions are likely to develop and there is no known way to prevent them. Within the alternative therapies, we have castor oil, dandelion root, and apple cider vinegar. Apply these substances daily for at least a few weeks, in most cases to see any results at all. Follow up. It is important to see a doctor if sudden new growth appears or if the angioma bleeds, feels uncomfortable or changes in appearance. Dermatofibroma. They are solitary, hyperpigmented, film nodules of unknown cause that measure 0.3 to 1 centimeter in diameter. Most of the time, they appear in adults and are commonly located in the lower extremities. The lesions are usually asymptomatic but can be pruritic. Physical examination. On palpations, dermatofibromas are fixed to the subcutaneous tissues and characteristically dimple when pinched. Diagnostic. The diagnostic is made by dermatoscopy, in which a peripheral delicate pigment network with a central scar-like area is observed. Treatment. Only of the patient's request can it be done. Complete excision, liquid nitrogen. Cryotherapy is performed. If in doubt, complete excision is recommended to confirm clear margins. What should the patient know before treatment? The scar can look worse than the initial lesion, especially on the lower extremities. Alternative treatment. Among the alternative treatments, we have jojoba oil and vitamin C and jojoba oil tincture. Solar lentigines. They are flat, oval, evenly pigmented macules in areas of chronic sun exposure, particularly the face, dorsal of the hands, shoulders, and back. Risk factor. Among the risk factors, we have to be of white skin. Only if lesions that are reported to have changed color, irregular margins, or develop a papular or nodular component should be biopsied to exclude malignancy. Differential diagnosis. Within the differential diagnosis, we have seborrheic keratosis, lentigo maligna, and lentigo maligna melanoma. Treatment. The treatment is only for cosmetic purposes. We can use liquid nitrogen. After hydroquinone cream 4% or triple combination cream with fluocinolone acetonide 0.01%, hydroquinone 4% and tretinoin 0.05% plus some protection can lighten existing lesions and reduce post-inflammatory hyperpigmentation. Follow-up. Follow-up is required if there are changes in the skin lesion, like changes of color and rapid growth. Alternative treatment can be aloe vera, vitamin E, licorice extract, and vitamin C. Lipoma. Lipoma are soft, painless subcutaneous nodules that range in size from 1 to 10 centimeters. They occur most frequently on the trunk and upper extremities and can be round, oval, or multilobed. Diagnosis. Diagnosis is usually clinical, but ultrasound examination can be helpful to distinguish a lipoma from an epidermoid cyst or a ganglion cyst. If symptoms such as pain or restriction of movement is rapidly enlarging or is firm rather than soft, a biopsy is indicated. Follow-up and treatment. If lipoma increases in size or becomes painful, you must tell your doctor, as it can be a sign that the lipoma is changing. Surgical removal of the fat cells and fibrous capsule is recommended.